Hi everyone, this is the chapter on teaching and counseling. Here are your learning objectives as always. Take a moment and review them. Remember, if you can speak to them, you know the concepts in the chapter. Remember when I said in class that you may not have thought that by becoming a nurse, you would also become a teacher or an educator? Well, you will be a teacher every day of your career. Teaching is something nurses do with their patients to educate them on their disease processes, healthcare needs, prescribed health interventions, and preventative health measures. Nurses begin teaching with their patients at initial contact. Our goal is to help our patients manage their health. One of the purposes of teaching is to educate our patients on ways they can maintain or promote their health status. This includes ways to prevent illness from occurring and ways to reattain a health status. You will work with patients, family members, and friends to adjust and cope with the changes in the patient's health status. You must have effective communication skills in order to correctly convey what you want the learner to know, to assess the learner's feedback on the teaching, and accommodate the different learning styles the learner will present with. Information alone may not change a behavior, knowledge, attitude, or skill, but effective teaching will help a person learn and hopefully help the patient make the necessary choices. Your textbook reviews possible topics for healthcare teaching and counseling. Pause and take a moment to review that. As a teacher, you always want to identify the learning outcomes you want your patient to achieve. This is very similar to us listing learning outcomes weekly in your syllabus and with each chapter that you are learning. This slide lists some possible outcomes you might choose for your patients. Pause and take a moment to review these. We are continually teaching our patients, but there are moments when teaching is planned and expected. This would be before receiving any care, at the time of discharge, or up to discharge. And remember, you always want to document any teaching sessions you had with the patient. This would include what you taught, the material you provided them, their response or ability to perform a skill, and any need for further teaching. When you learn something, you somehow will have a change in behavior, knowledge, skills, or attitude. Learning can be spontaneous, like the phrase says, you learn something new every day. Or it can be deliberate and goal-oriented, like your nursing classes. Some learning takes place subconsciously through observation. As a matter of fact, I think a lot of times that's how it happens. In your classes, you're learning a lot through an active process of learning by preparing for class, through listening to these PowerPoints and doing your reading, and your participation in class learning activities. To maximize your teaching effectiveness, try to remember the TEACH acronym. T is to tune in to your patient and pay attention to their cues and what they're telling you. E is for edit, go through what they have told you and displayed and pick out what's important. A is for act. You need to seize every teaching moment possible. That could be even when helping a patient with their ADLs or bathing. I feel like it's all the time. C is for clarifying often. Make sure your teaching is effective and that the patient is getting the information that they need clearly. H is for honoring the patient as a partner in their learning journey. Your book goes over the steps of the teaching learning process. Pause, take a moment, and review them. So what affects patient learning? A lot of things. I want to say when you're doing your charting, never say they don't have any barriers. They all have something. First, we have to consider, what is the patient's age and developmental level? In Block 1, we are focused on adults and older adult learners. For adult learners, they first have to perceive a need to learn something in order to become engaged and actually learn. So, do you find that's true in yourself? I know it is for me. For older adults, we must assess if they have any communication or sensory deficits like vision or hearing impairments, mobility problems, or impaired cognition. How about pain? All of these will require the nurse to modify the teaching plan. Family support networks also make a difference. The family may have little to no coping or support mechanisms. The COPE model is a great method to help families be better problem solvers and support their learning about the health care material. It's in your textbook and reading assignment for the week, so make sure you go over that. Take a moment and review it now and come back and hit play again. Finances also play a role in the patient's ability to participate in care or acquire necessary health supplies. Cultural influences and language deficits can also be challenging in teaching and learning. You will need to refer to resources like your Cultural Perspectives resource and Lippincott Advisor in order to be knowledgeable and competent in your cultural care and teaching. You will need to know what your agency has available for you to use. Health literacy is a barrier also. Over 90 million people in the U.S. lack basic reading and writing skills. Health literacy raises the bar on that number. Your book lists several tools out there to assess and help a patient with a health literacy barrier learn. Go through and read about those. There are 3 domains where learning can take place. Cognitive learning includes putting away and recalling information in the brain, so storing it for later. This can include memorization, recall, comprehension, analysis, synthesis, application, and evaluation. Being able to identify correct lab values would be cognitive learning. Psychomotor learning requires both mental and physical activity. This would be your skills that we are teaching you, like physical assessment and medication administration. Affective learning involves changing your attitudes, beliefs, feelings, and values. When I reviewed the statistics of medication errors, you may have had a change in your attitude or beliefs about the safety of our medical system. This was also a form of learning. Your chapter in your text goes over suggested teaching strategies for these 3 domains. Pause and take a moment and review them, because you'll be doing this teaching in just a few, well, actually probably this week. So get familiar with it. There are several different types of teaching strategies. When evaluating which one to use, consider the learner's needs and learning style first, and then look at what you feel would fit that best for them to learn, not which one you are the most comfortable with. There is the traditional lecture, but this is passive learning and not much is retained. This is kind of that right now. So I hope that you're doing something to help you retain this information. Group discussion is effective in an atmosphere of trust with everyone participating. You need to be open to ideas and assuring confidentiality of the content of that discussion. This is less effective with larger groups, like a class size of 52, and the teacher must be comfortable with being a facilitator and letting the group have control of most of the information. Also, sometimes groupthink comes into play, or you have a dominant member monopolizing the discussion or idea making. Demonstration and redemonstration are good for psychomotor skills or tasks. So, for example, you're showing the patient how to change their wound cure dressing. Having them do it assures that they got the message and they're doing it correctly. Make sure the redemonstration takes place closely after the demonstration. Also, redemonstration has to occur in order for the teacher to be assured the learner is doing it correctly. This also does not work well for large groups or for those who learn through observation. It is also time-consuming and labor-intensive. One-on-one instruction and mentoring are often used in nursing. The teacher and the learner formulate objectives prior to the learning session, and the learner receives printed or audiovisual materials or referrals to websites for the information. This is labor-intensive, but this method is effective in all 3 domains of learning. Printed materials need to be in the learner's native language and at an appropriate literacy level for the learner. If you work for a healthcare organization, they have many links that they are pre-approved to share with the patient. When you choose those materials, it automatically links them to their healthcare record, and then you can print them and leave them with the patient. And they're written at, I believe, a 4th grade level. So that's in the larger hospital systems. Make sure the material is not full of medical terminology, but instead it's easy to understand, and at about a 5th grade level. Printed material allows for standardized information to be presented to each patient, and it allows the teacher to cover main ideas with the printed material to show further details. Role play is used to learn in the affective domain. You take on unrehearsed roles without a script and work through a situation. This usually requires a follow-up discussion by the participants to talk about feelings and observations while in their roles. We are going to be doing this in simulation. Role modeling is leading by example or demonstrating behaviors that learners should adopt. Audiovisual materials come in many forms, including the internet sites. It is a stimulating method and can accommodate large groups. It may be expensive or not available at your facility. Web-based instruction can support your instruction. Be sure to evaluate the website for accuracy of information and make sure that it's suitable for your purpose. Oftentimes, we encourage patients to video us on their phones if they are doing a complicated dressing change, or if we are, or a procedure, because they can always refer back to it. And actually, in your lab class, we have videos available to you that will help you standardize your practice, and it gives you a good view of what's happening instead of trying to video us while we're demonstrating something in front of a large group. We do ask that you not repost anything anywhere, and it can be a violation of copyright as well as privacy, and that is also in your student handbook. So make sure that if you do video something, you do not post it anywhere. Also, patients can take daily photos of their wounds after discharge to show the prescriber regarding their progress or lack of progress in wound healing. Sometimes we have to motivate our patients to learn what we're teaching them. I feel like this is oftentimes the case. Some technologies to help this process along are showing, or I said technologies, techniques. Show genuine interest in the learner. Create a friendly environment where questions are encouraged and welcome. Show your patients the physical benefits of what you're teaching them. Be their cheerleader when they do something correct or when they actually achieve something, a milestone. Readiness to learn is important to assess prior to beginning your teaching. Make sure your patients are physically able to receive the teaching. Make sure they are not in pain, they are strong enough that they can hear or they can see what you are teaching them. Make sure their emotions are stable and they're not anxious, stressed, or in emotional pain. You must present the information at a time when the learner is open to learning. Teach shortly before they need to apply their knowledge, or assess if you need to break the information up over intervals of time. Active involvement in the learning will help the learner retain the information. Demonstration and redemonstration, or having the patient restate the teaching helps with this. That's also why we don't have you sitting in a class listening to a lecture, but instead we use that time for group work, various interactive exercises, games, and clicker questions. This helps you retain the information better. I think we all thrive on positive or constructive feedback. This is important to give to your patients while they are learning also. Repetition is another key in learning. That is why we have you practice in the practice lab for hours before a skill checkoff. More repetition results in better learned behavior outcomes. Come prepared with all of your teaching materials and prepare an environment that is comfortable, quiet, and private. Plan for uninterrupted time. Don't plan a teaching session when you know the patient will be going down to x-ray anytime soon. Judge the type of information you will be presenting and how much information your patient can process at one time. You may need to plan for several teaching sessions. Use your communication skills to assess if your patient received the content as intended. For patients who have special needs like a learning disability, communication disorder, or an attention deficit disorder, you may need to make adaptations to your teaching. Include a caregiver or family member to be present during the teaching to reinforce the learning. Sometimes nurses have to create contractual agreements with their patients. This is informal and not legally binding. These can serve as motivators and reminders to the patient of what needs to be accomplished. Your chapter has samples of what might be included in a contractual agreement between a nurse and a patient. Pause, take a moment, and read through that. The nurse must also consider time constraints when planning teaching. Make sure you prioritize your teaching activities and plan for the time needed to instruct the patient. It is usually better to plan shorter, more frequent teaching sessions. This helps patients to digest the information and think of questions to ask. Sessions of about 10 to 15 minutes are usually about the right amount of time. Also, make sure they are not in pain or stressed at that time. The nurse also has to decide if the patient would benefit from one-on-one teaching or if group teaching would be more effective. Your textbook has an example of diabetic teaching effectiveness in a group session. Pause and take a moment to read what the research revealed. Informal teaching can occur anytime you are with a patient and you want them to benefit from your knowledge. Formal teaching is more planned, and usually the nurse has outcomes in mind that they want to achieve. The nurse is called upon to have their patients make changes to produce better health outcomes and healthier lifestyles. Coaching can help the patient achieve this goal. The nurse coach will help them, they will help work with the patient to identify the patient's personal goals and how they want to approach the learning. What works best to teach them? It works best to teach them in that manner and help them achieve their health goals. The nurse coaching process is listed on this slide. Take a moment and review it. After we have completed the teaching, we must evaluate the effectiveness of our teaching in what the patient learned. This can be done by the patient doing a redemonstration of a skill, verbalizing back to us the cognitive learning or that you reteach that took place, and being able to answer questions correctly. If the patient achieved their goals, then it's time to acknowledge it and celebrate it with them. Everyone likes feedback, especially positive feedback. If the patient did not achieve the teaching goal, the nurse must evaluate if they took the correct teaching method for that particular patient, or do they need to use a different approach? Was there enough teaching done, or does more need to be done? Maybe the plan needs to be revised and new goals and approaches need to be tried. Lastly, we always need to document our summary of the teaching needs for our patient, the teaching plan that was done, the patient's responses and learning, and any needs for revisions. The nurse also has the role of counselor. We help the patients make informed decisions, and we help them work through the decision-making process. We don't make the decisions for them, only help them along the way. We try also to make the patient feel comfortable talking to us and address issues of concern while they are going on. This can be a formal session, or it can be something you notice and bring up to discuss while you're being with the patient for other interactions or interventions. The nurse needs to be sensitive to each individual situation and know the resources available to have the patient turn to if needed. The nurse needs to be caring, open, friendly, and approachable, and know how to respond to various situations. Your textbook has some good examples of ineffective responses to patient concerns. Pause and take a moment to review these and refer back to them in the communication chapter if you need to. There are different types of counseling the nurse may perform also. Short-term counseling focuses on the immediate concern or problem at hand. This can be used in a situational crisis. Try to get the patient through the immediate problem so that they can move on to better health. Long-term counseling is just what it sounds like. You continue the counseling periodically over a period of time. This is common in nurse-led support groups. Motivational interviewing involves discussing the patient's feelings and any incentives with the patient. I always say that your teaching should be what is in it for them, or why would they benefit from the teaching or counseling. If the patient doesn't see the benefits, they may not be motivated to make the change. This can promote self-confidence and have better patient outcomes. The nurse must consider the patient's cultural values in this also. If it goes against someone's cultural beliefs, all the motivation in the world will not make the patient change their health habits. Lastly, the nurse needs to know when the patient needs further counseling than what we can provide. So don't overstep your own scope of practice, and make sure you're maintaining your patient boundaries. Referrals to social work, psychiatry, or mental health professionals, clergy, or a sex therapist may be indicated, and the nurse should initiate that if they feel the patient could benefit from their expertise. Also, make sure there's no barriers that exist, like transportation problems or timing, that can affect the patient following through on the referral. All right, we have come to the end of this chapter. Make sure you write down and bring any questions you may have to class. Thank you.